Welcome. Today we are presenting an educational video on the Dermarite Type 1 native collagen dressings. We will be discussing the dressing as well as application tips. Dermacol 100 sheet and Dermacol 100 powder dressings are highly absorptive, protein-based wound dressings made with 100% Type 1 native collagen for wounds with moderate to heavy amounts of wound drainage. Native type 1 collagen is a protein found in the skin, tendons, ligaments, and bone. It is the most abundant collagen in the human body. Collagen wound dressings help to stimulate new tissue to form in the wound to help it heal. Collagen dressings help to provide the structure needed to rebuild new tissue in the wound. The dressings also help to balance the naturally occurring enzymes in the wound and preserve the naturally occurring collagen in the wound to promote wound healing. As the dressing absorbs, it becomes gel-like and molds to the wound bed to provide a soothing dressing to cover the wound. Dermacol 100 sheet dressing is a thick collagen sheet that gels and molds to the wound as it absorbs wound exudate. Dermacol 100 powder becomes a soft gel-like paste that is less visible as it absorbs moisture. If your wound drains heavily, you may only see small amounts of collagen residue when you change your dressing.
As you prepare to apply a new dressing, gather your supplies together onto a clean working surface, and then thoroughly wash your hands and apply gloves if available.
As you prepare to apply a collagen dressing, clean the wound as directed by your healthcare provider. Each package has step-by-step instructions to help you apply the dressing. Follow any instructions given by your healthcare provider related to dressing application. Some tips that will help you with dressing application. Either side of the Collagen 100 sheet dressing can be placed directly on the wound. The Dermacol 100 sheet dressing can be cut or layered as directed by your healthcare provider. Loosely fill the wound when applying the dressing to a deeper wound to allow the dressing to expand as it absorbs drainage. If you are using Dermacol 100 powder, after cutting the packet to open the product, pour the powder over the wound to cover the wound surface. Always consult your healthcare provider for specific application instructions related to your wound. Dermacol 100, both sheet and powder dressings, will require a cover dressing to hold the dressing securely in place. Your healthcare provider will select a cover dressing based on the amount of drainage from the wound, the amount of time desired between dressing changes, or for other reasons, such as to provide a waterproof dressing cover to protect the wound from exposure to water during showering.
Dispose of used dressings properly. Never reuse a calcium alginate dressing.
After you have applied a new dressing and discarded the used soiled dressing and gloves, be sure to complete the final step and wash your hands thoroughly. For more information on Dermarite products, visit our website at www.dermarite.com.